I think we can probably get started then. I'll just do a little bit of an introduction. So thank you so much, everyone, for joining today. And welcome, Nicole and Jenny from Amref Health Africa. We're so happy to have you with us today. As most people on the call will be very familiar with the fact that for WELLReceived, giving back is one of our core values, and it's really important to everything that we do. And we're very proud to be able to support organizations like yourself that really make a difference to underserved populations and providing much needed medical care to those around the world. So on the call today, we have WELLReceived team members from various departments. So we're all kind of spread across the globe. I'm in Scotland. We've got many team members in the US and Canada, and the UK and India. So very happy that we could all kind of find a time that worked for everyone to come together and learn more about this amazing cause. So I'll hand it over to Nicole and Jenny, and you guys can maybe take us through a little bit about the work that you do, and we'd love to ask some questions at the end as well.
Okay, perfect. I'm a big fan of showing pictures of our work as well. So Nicole is going to share her screen so you guys can see some of the images of our work that we do. So Nicole, are you able to share your screen, Nicole? Perfect. Awesome.
Great.
Okay. And you guys can all see that too?
Yes, we can.
Fab. Okay. So my name is Jenny. I am the Senior Manager of Development here at Amref. I moved here to the New York area. I actually live in Jersey. Our office is in New York City. After having lived in rural Tanzania, East Africa for over 12 years, I was first a Peace Corps volunteer, and I taught math and physics and found myself in the right place at the right time. And then ended up running a grassroots project dedicated to vulnerable children. And it's while living in Tanzania that I heard about the work of Amref. It is like a household name across East Africa. Everybody knows and loves Amref. And I'll let Nicole introduce herself.
Hi, everyone. So I'm Nicole Alexander. I am probably about 9 weeks into my position here at Amref. I'm coming from a very criminal justice heavy background. I also live in New York. I live in upstate New York, though, but I went to John Jay College of Criminal Justice for my undergrad and switched over to a more communications focus for grad school. And I'm just excited to be here. And I'm leading you through the presentation, but if at any point you can't see or if it gets blurry, please let me know.
Amazing. Okay, so I figured it's always good to start with our history, where we are to where we are. So Amref was founded in 1957 by 3 lovely and very charismatic gentlemen who had the love and the passion of helping vulnerable communities across Africa with this idea of flying airplanes into remote areas to perform surgeries, as they were all surgeons, and then to train up the local health workers. Amref has now transformed into what it is today, changing from more like a mom and pop style organization to an expansive one, working across 35 countries in sub-Saharan Africa. Our headquarters is in Nairobi, Kenya. 97% of our staff come from the communities that we work in. This uniquely positions us to tackle African challenges with African expertise. And another thing that I think really sets us apart is that we are the largest healthcare nonprofit based on the continent of Africa. A lot of other large INGOs have their headquarters based elsewhere. Our vision is of lasting health change in Africa. Our approach is community-based, and it's rooted in local, social, political, civil, traditional structures, making the people that we reach partners rather than just a beneficiary. And we empower the most vulnerable to transform their health for the long term. One question, I was given a set of questions from you guys, and one question that was asked was, how do we decide where to direct our work? Really, it comes down to the community. The community needs dictate where we work and who we partner with in the government. And then the government and the donors help allocate resources in line with these community needs. So it just shows what a symbiotic relationship that we have here. We are an effective organization. We combine grassroots development with government partnerships. And this ethos really defines our community-based approach and echoes across each one of the projects and programs that we deliver. So overall, because we are so ingrained in each community, our projects are really impactful and sustainable. We take this holistic approach to health. Any problem that comes up, we tackle it instead of just being limited to maybe one focus area. So we are also the partner of choice by the African Union, the Africa CDC, the WHO. In fact, our global CEO, Dr. Gitinji Gitahi, was recently appointed as the commissioner in the newly created Commission on African COVID-19 Response, which is led by the president of South Africa. He's a medical doctor, has many senior roles across public and private sectors, and is a member of the Africa CDC Governing Board, and is the co-chair of the UHC 2030 Steering Committee, which is the World Bank and the World Health Organization Initiative for Universal Healthcare. He is also very well known for his charisma, his ability to speak, his leadership roles, and his passion for reaching the most vulnerable. And you might have seen him. He's been recently posted on the Wall Street Journal, the New York Times, CNN, BBC, and a couple weeks ago was invited by the White House to speak with President Biden on vaccine equity. In the United States, our office is in New York. We help raise awareness and funds for the work that we do across Africa. So the core of what we do, Amref, like I said, responds to the most critical needs challenged in hard to reach places across Africa. We work in maternal and child health, girls empowerment, clean water and sanitation, fighting diseases, surgical outreach, infections, and non-communicable diseases. But our true cornerstone is really training up healthcare workers and strengthening health systems. But last year, Amref had kind of a banner year. We ran 206 programs, 27 of which had to do specifically with COVID. Our services reach over 35 countries in sub-Saharan Africa every year. And last year, we reached 10 million people with our health programs. On this map, the red countries are the ones where we actually have an Amref office as well as programs. And then the orange is where we have our reach. So if somebody maybe went to a training and they go back into their home countries, or where we have our distance learning programs. Sorry, Nicole. I wanted to go into, because we do so much, I thought I would maybe focus on a couple of the areas, especially after seeing some of your questions and maybe interest areas. So girls empowerment is something that we focus on, not solely, but is one of the areas. So too often girls in reproductive ages, so like 12 to 49, are subjected to female genital mutilation, or FGM, which is a traditional practice that signifies their transition from girlhood into womanhood. And oftentimes this is going to be a precursor to early childhood marriage, and in doing so will force them to quit school. Also, it leads to early teenage pregnancy, and FGM can cause severe bleeding, problems with urinating, cysts, infections, painful sex, complications in childbirth, and will lead to an increased risk of maternal and child death. And we at Amref view this as a violation of the rights of girls and women, and a preventable health risk. Schools often are safe havens for girls. So especially for those that are most at risk to female genital mutilation or early childhood marriage. We are determined to ensure that these girls have access to educational opportunities, including having a boarding school scholarship program. So part of this program is that these girls would, they're put into a safe place. They're given mentorship. We train up teachers and healthcare workers so that the teachers can provide comprehensive health education. The healthcare providers provide quality youth friendly services. And then we also, if it's in a public school, can provide both boys and girls about sexual and reproductive health rights and the risks of early pregnancy and FGM. And as a note, one of my favorite parts of this project is these girls on the scholarship program have these peer groups that on school holidays they meet with, and they talk about menstrual health hygiene. They talk about the traumas they faced of the cut or family pressures to get married or things. And they're being counseled and led through these discussions with a trained Amref health provider. And so it really provides them this opportunity to be free and ask the questions that they really have pressing on their hearts. So not only do we empower these youth with the knowledge of their sexual and reproductive health rights, but we are also training them on how to effectively advocate for policy change around these areas. So we partnered with communities all across East Africa, knowing that there is a traditional culture of like from girlhood into womanhood. And often because the cut is so dangerous, we helped create an alternative to this ceremony. And we call it the alternative rites of passage. So the girls get together, they have a ceremony with their community members where they talk about FGM and why they are going to not undergo the cut. Their communities celebrate them entering into womanhood. And I just thought this was a very powerful number. We have 17,000 girls so far that have gone through this ARP up to date, and the number is growing. So I thought this was just an amazing program. Another topic area that we work in is on maternal and child health. So nearly all maternal deaths are preventable with access to prenatal care, a skilled care physician or attendant during childbirth, and support either before pregnancy, during pregnancy, and care in the weeks after childbirth. The incidence of maternal and child death in Africa is so high because so many of these women are giving birth at home or they are living so far from a hospital that it takes so long to get there. And maybe they have to deliver a baby on the road or in their farms. And if they do get there, sometimes these health facilities are oftentimes too poorly equipped. So pregnant women in Africa need this basic healthcare, a trained healthcare worker, and these health facilities. And so this is where Amref comes in. We work to expand access to these health centers and to healthcare for mothers and their newborns. We work on increasing the quality of prenatal and postnatal care. We provide women with checkups, nutritional information, that, a lot more as well to keep both mom and baby healthy. And then we work on training local midwives and doctors and nurses, this higher cadre of health professionals to ensure safe deliveries. One midwife can provide care for and I should say health education to over 500 women annually. That's just another impressive stat to me of the difference that just one person can make. We also work on distributing vaccines for normal childhood illnesses to prevent disease that can be deadly for both the pregnant women and newborns. And then we make sure that women receive information, services that might inform her reproductive health decisions. And then one of my favorites, and something I saw myself in Tanzania, were these mother-to-mother support groups, so that a mother of a newborn baby would have other mothers advise her on things like when to go to the clinic and breastfeeding help and just overall emotional support. So we trained up women to be these community health volunteers. So in terms of training healthcare, local healthcare workers, African countries would need to increase their workforce by 140% to provide services that would make a positive health difference in the overall health and life expectancy of their populations. 140%. So like right now, there's an average of 2 doctors and 9 nurses available for 10,000 people throughout sub-Saharan Africa. If you go to rural populations, it might be less. So the solution is clear that there needs to be more healthcare workers, and it's needed in a place that has the highest disease burden. The cornerstone of Amref's work, like I mentioned before, is this rapid scaling up and strengthening of training for healthcare workers across the continent. We do this through a mobile phone training app called LEAP. It trains up healthcare workers either using a burner phone or a smartphone. It's an interactive platform in their own language, and it uses text or audio text or audio messages, and it can be functional anywhere, whether they live in a poor urban neighborhood or a distant rural community or the middle of a city. The frontline health workers across these continents that use LEAP are also trained in recent year on COVID. So how to identify, isolate, and refer suspected cases, education on how to maintain their own safety as a health worker, and how to prevent misinformation from being spread so that they know how to educate their communities on COVID-19 as well as preventative measures. So another question that was asked was how LEAP changed, and I loved that question. In 2013, when LEAP was started, it was just initially in Kenya, and it only had 7 core curriculum areas, like infectious disease, non-communicable diseases, maternal and child health. And today it has over 30 different types of curriculum, including mental health first aid. There was in the last year a very rapid expansion of LEAP that happened due to COVID. So normally these healthcare workers had been trained in a face-to-face method, and once the lockdowns happened, they were forced to be at home. How are they going to help their community? Well, LEAP was expanded across Malawi, Ethiopia, South Africa, Uganda. Curriculum was bolstered. And now it's used most often by these community health care workers. So these are the people I fondly refer to as the eyes and the ears of the community. Most often they're unpaid. They go from the house to house, educating and checking in on their neighbors, identifying, oh, this person might need to go get tested for HIV. Oh, this baby isn't doing well. Maybe there's a case of malnutrition that needs to be reported. This person looks like they have the signs and symptoms of COVID, or this person's mental health is suffering. We need to work with them. These people are connecting us from the grassroots level. They're acting as the bridge to the formal healthcare system. Also, in the questions that were submitted, you guys had also asked about the International Training Center in Nairobi, and I think it's a good space here to bring that up. The International Training Center is a building in Nairobi that hosts trainings for students. So there's kind of 2 buckets of these students. There's sort of like the pre-training. So these are people that want to become a healthcare provider. So a nurse, a midwife, or a health technician. Or there's people that are already a nurse, a midwife, or a health technician that want to level up their employment. So we have continuing education programs for those people wanting to level up. And a fun fact to connect it back to LEAP is that all of the programs and education and curriculum that's created at this International Training Center is how we develop all the curriculum for LEAP, our program. So I thought that was a fun tie-in for you guys. And then for the COVID-19 is just such a prevalent topic. for the last 60 years, Amref has focused on what it is needed during pandemics. So our mission and our vision is to build up a better and more resilient health system. COVID-19 has not changed what we do, but it really has changed how we work. So COVID-19 has posed a considerable threat to the people in Africa. They already have an overburdened health system that is very under-resourced when you consider the already ongoing disease burdens like HIV, TB, malaria, as well as non-communicable diseases, diabetes, for example. So we work closely with African Ministries of Health and the Africa CDC and the WHO in launching preventative measures to curb the spread of COVID-19. We have been, since 2019, responding to and preparing for this pandemic. In fact, we were one of the first organizations on the continent to not only take action, but also work with governments to create these long-term strategies to mitigate this pandemic, but others that might be coming. So as we all know, in different countries, our globe has been cycling between lockdown and reopening and lockdown and reopening. And there is some serious concerns about variants of this virus and the greater transmissibility across Africa and the globe. So COVID on these particular focus areas have really defined what our work has been in the last year. Cases of gender-based violence, for example, FGM, child marriage, physical, sexual, verbal, emotional, psychological abuse, economic and educational deprivation have risen drastically. In Kenya, there is a national gender-based violence hotline. And if you look at February of 2020, before Kenya went into lockdown, there was 86 calls. So that would be like, let's call it a normal call month. In June of 2020, so everybody's home, unemployed, there were over 1,100 calls on this gender-based violence hotline. So I think that just indicates what we had work to do in. There's a lot of misinformation and myths about COVID, just like there is everywhere, spreading across Africa. The mental health of our frontline healthcare workers was really impacted significantly. They already have low amounts of PPE, lack of training. They saw a dramatic increase of patients. And then on top of it, they're also dealing with lockdown restrictions. So there were curfews and mandatory transport documents required to travel in certain places. And this resulted in expectant mothers having to give birth at home again. They weren't able to get to a hospital because it was maybe across a border or after hours. Another way it impacted a lot of community members because they were afraid to go to the hospital and get their HIV medicine, their tuberculosis medicine, things that need to be taken on a monthly basis. Child immunizations decreased. Mothers were afraid to bring their kids to the clinic to get an immunization for fear of catching COVID. But I think our overall biggest challenge during these last years with COVID was to keep up the already existing programs that we run because we had to do them really differently. So I sort of mentioned the challenge of the women not getting to the hospital. And the silver lining, I think, of everything is that these very creative programs are that take a lot of different players are created. So there is a new program that was developed in Kenya called Wheels for Life, where a phone telecom company, a taxi service, Amref, and government partners with the hospitals created this hotline for pregnant women to call and say, I'm in labor. A nurse or a doctor would answer, ask them a series of questions, and then decide they should come now or they should wait. They would help them find a taxi for free and get them to a hospital across borders and maybe after curfew so that they could deliver safely. This program will probably continue on past this current lockdown and pandemic. And I think it was just a very nice thing to highlight that it's, like these creative programs are here to stay. And another one of my favorite projects is, and it kind of ties on with a question on, do I envision a world where all women and girls have access to basic education around healthcare and basic healthcare? I mean, yes, we absolutely believe in a world like that. We follow the SDGs, SDG 2030. And, you know, right now, girls, like the big tragedy of COVID in Africa, and there's so many cases of girls that have had their educational rights taken away from them. We have seen in our scholarship program, our community champions and our Amref program staff have gone during the lockdown in pandemic protocols, house to house, to work with the communities to educate them on FGM and why girls should still stay studying during lockdown and not get married. And of the 300 girls in our scholarship boarding, like full scholarship program, the ones most at risk to FGM and child and early marriage, 93% have returned to school when schools reopened, and the other 7% are currently being followed up with. So that's, I think, a huge success in like how our programs are going. And I know that you guys had other questions, and I know that time is running out. So I kind of want to leave it there in case. I tried to take some of your questions and sprinkle them through our slides, but if you have any others, I'm happy to. I know there's a few I didn't get to yet, but any other pressing questions?
Thank you so much, Jenny and Nicole. That was great. That was amazing. So much, great information. And you work on so many projects. So that was, really, really interesting. So thank you. But if anyone does have any questions that haven't been covered already, please feel free. Anyone?
I'm sorry, I have a question regarding FGM. Is that something that's illegal in Africa, or is that something that's still an accepted practice?
Well, it is in Kenya, for example, it is against the law, although many cultures still, and it's recently against the law in Kenya. Many cultures, especially the nomadic tribes, still practice it, and especially in East Africa. However, we had this momentous Kisima declaration in March, where our clan leaders, our elders came and said, we're going to be done with this practice. It's harmful to our youth. So there's definitely progress being made forward. It's slow, but it's there.
Okay, thank you.
Nicole, do you want to maybe stop sharing your screen and then we can see all your faces? Perfect. Any other questions?
I have one. Like again, it is about FGM. What were the major challenges you faced when you were talking about the alternatives? Because I don't know how accepting communities are, especially when it comes to a change this big.
Yeah, behavior change takes a very long time. So I speak a lot about Kenya. This program also exists in Tanzania as well, and it's being implemented in a few others. But this alternative rites of passage, it involves our community workers working alongside. So a lot of the nomadic tribes are a patriarchal society, and so it's working with the clan elders. And then it's choosing a man and a woman as a champion. It could be any age, where they go into their clan meetings and they say, you know what, I don't think this is right. I think, I've been taught that it means 1, 2, 3, and 4. It can cause childbirth. My wife can die. I think, she deserves an education. So it's coming from within. And it took a very long time to get there. And there's still a lot of work to do. But we are, I think there's certain tribes that are, the education has been there for longer than others. And so it's just something that we will keep working on, over time.
Terry, did you have a question? I feel like I did see you start speak, but I can't hear you. Can anyone hear?
No,
Is it just me? No.
No. While Terry, while you get your let me do a little plug here. While you get your sound working, we just had a lady named Nice. She wrote a book called The Girls in the Wild Fig Tree. She put out this book recently. It was launched at the beginning. And I can send you guys the book launch call if you're interested. But it is about her life and how Amref was involved in rescuing her from FGM and what that meant for her personally. It's a phenomenal book. Yeah, it's really good. And in fact, the Nice Place Foundation just opened last week, which is her school, her boarding school for girls at risk for FGM.
Wow, yeah. Like if you can share over the details, that would be great, and we can share it out with everyone.
Yeah, absolutely.
Perfect.
Can you guys hear me now?
Yes.
Yes. I wanted to ask, which Amref project are each of you most proud of?
I mean, that is such a great question because we do so many. I think so. My favorite is the mother-to-mother support groups and the Wheels for Life, just because I am a mom. I have 4 kids that were raised in Tanzania, and for me, watching, like, I was part of the mother-to-mother group. Like, they invited me in as a new mom, and I got to experience what that was like. So I thought that was really, like, I got to see what they talk about, and it really is just encouraging each other. So that is, I think, my favorite, and making sure moms deliver safely. So
I'm still learning. I feel like every day I learn about a new program or initiative, but I definitely appreciate the training and like retraining of healthcare workers. I come from a very healthcare deep family, and I've watched them re-up or learn more or evolve past their current level to reach more people. And it's definitely important to have the training because one person really can impact a large group, especially when they're coming from within. I feel like patients tend to listen to people more if they look like them, if they have similar cultures. So that's definitely a selling point for me.
Awesome. Thank you.
Yeah. Well, we also just want to extend our deep gratitude for such it was such a generous gift that you guys sent. So thank you all very, very much, and for your wonderful questions and the opportunity to speak with you guys today. It is our pleasure to help spread the word of what Amref does and get more people involved and excited about it.
Great. Thank you so much. We really, really appreciate the presentation. And yeah, it was lovely to have everyone together to kind of learn more about what you guys do. So yeah, thank you so much.
Yes,
thank you.
And I'll send you around those book details.
Yes, please do.
Yes.
Okay, great.
Okay,
thanks so much, everyone. Have a great day.
Bye.
Thank you.
Bye.
Bye.
Have a good day.
Bye.